Welcome to the second trimester where your body is changing a lot. Your center of mass is changing, your posture is changing, your breathing is changing, everything is just changing, and your pelvic floor is taking on a lot more load. Hello, my name is Oriana. I'm a pelvic health physical therapist assistant who is also in my second trimester, and I want to give you all the tips that I have on what you should prioritize when it comes to movement, breathing strategies, and exercise as you navigate this time of your life. So what exactly is happening and what should we consider whenever we're choosing exercise and just like daily movement in our functional life? Let's start from the top and then go on down. So from the top, it may be harder to breathe, right? And that's because your rib cage is starting to open up and starting to create space for your growing abdomen. And that's gonna stretch out the front of your abdominal wall, which is necessary. We need that. It will create that diastasis, which is a good thing. We wanna decrease how much that's happening by learning how to exhale as we do different activities, but it also makes your back tight, especially right where your rib cage and your lower back meet. It makes that part of your back really, really tight, and that affects your diaphragm, and that's going to affect your pelvic floor. If the diaphragm is not expanding completely in all 360 degrees that it's supposed to, so if you were to see it back here, it should expand out in the back, it should expand out to the sides and out in front. If it's not doing that, that's going to create pressure through your pelvic floor. So we're going to want to work on oblique strength, serratus anterior strength, and working on our transverse abdominis strength. And we want to work on exhaling with every little thing that we do. Moving on down to the pelvis, so we know that your abdomen is stretched out, your upper back is a little bit tighter, your rib cage is open up, right? Your pelvis, your lower pelvis is also rotating a little bit more forward because again, the uterus is coming up, it's creating more pressure on that lower abdominal wall, it's stretching out the abdominal wall. So your pelvis is moving forward. This is gonna make your glutes a little bit more weaker, your hamstrings, your adductors a little bit more weaker, and also your glute med is not really gonna get what it needs, so we need to work on that as well. And as your pelvis moves forward like that, it makes your legs rotate out. That's why women tend to get that waddle towards the end of their pregnancy. So we want to make sure that we maintain that hip internal rotation. We want to decrease how much of that waddle happens by keeping that mobility going inward. The other thing that's important to know is that you may notice that during this time, you're starting to lose your balance with things that you normally can do no problem. If you try to go on one leg and all of a sudden you kind of topple backwards, it's because your center of mass is changing. The body is having more weight go forward, which is throwing you off a little bit, and that's okay. Again, that's good, that's normal, but it's a good idea to keep working on the ankle stability so that way you can keep yourself safe and protected and keep your feet protected as you navigate through the rest of your pregnancy. Lastly, this is the time when you start to modify activities. So if you're a very active person and you love to do planking or you love to go to Pilates, doing exercise classes, something like that, it's time to elevate the surface. It's time to stop decreasing how much pressure is going through your abdomen, instead elevating it so that way you can continue to do that core strength that you love to do, but just making sure that you're not putting too much pressure on the tissue that's stretching quite a bit. So now I'm going to show you examples of exercises that you can do. Starting off with like a dowel press is what we would call it here at my clinic that I work at. But you can take like a broomstick, any sort of just like stick, a PVC pipe, all those are kind of bendy, but you just take a stick, right? And you're just going to push it down into the ground. So it's like I'm pushing it down straight into the ground. I'm going to exhale while I do it. Whenever I inhale through my nose, I'm going to feel that back expand. Whenever I exhale, I'm going to push the dowel or whatever it is down as I exhale out through my mouth. So it'll look like this. And hopefully my lower belly lifted in that video. I could feel it lift, so hopefully that happened. Hopefully you see the expansion happening back here as well. I'll do it one more time. Next up, we're going to do like a Palloff press. You can also do it with rotation as well, where you have some sort of resistance cord coming at an angle. You're going to have your hands wrapped around it. You're going to exhale as you push out, right? So that's the press portion. And then the rotation portion would be to exhale while you push and rotate. So it'll look like this. And one thing that's important to know is that when people do this, they always arch their back, but I want you to kind of keep your ribs together and think about bringing your top rib down towards your bottom hip. So if I had the cord, it would look like this. So it's not directly straight out, it's getting my body to cover over this abdomen. I mentioned serratus strength, but I wasn't planning on doing one for this video. I'm just gonna kind of talk about it really quick. Serratus is when you're like punching, right? And so you could put your hands on a wall here, and then you can push against the band while your hands are on the wall, and you would inhale as you go this way, exhale to come out of it, and that's going to help you get rid of any of that tightness that's at that mid-back area, and it will help you continue to strengthen out your obliques, your serratus, everything that helps to decrease that intensity of abdominal separation. Next up would be RDLs with a band, and so you can take a really, really long band of some sort. And by the way, everything that I've done so far and everything that I'm going to continue to do is having my toes pointing forward as best I can tolerate it. If it doesn't feel good, then don't force it. But having toes forward will decrease how tight those hips get and decrease how much your body is trying to be pulled through that like really low back posture. So for the RDLs, this gets out your hamstrings. You just grab like the bottom of the band. Make sure you're not here because all my pregnant moms want to be there. Keeping the ribs, the front of the ribs together, taking a deep breath in, exhaling while you stand up. And you should feel the back of your legs activating. So I feel both of my hamstrings activating as I push through my heels and stand on up. Then I mentioned that hip internal rotation. So this is kind of like that hinge that we just did. You're gonna grab some sort of weight. You're gonna hinge at your hips and then twist while you reach the weight towards your pinky toe, and then come on back to like a little row for that upper body, and you go in and out. And what I'm doing is I'm trying to make sure that this hip is going to this inner thigh, the opposite inner thigh. That way I get that internal rotation, which is also gonna help me shorten that adductor to make it a little bit stronger when I move on to other activities as well. For this one, you can inhale as you go down, exhale to come up. Unless it's a really heavy weight, then I want you to exhale during the whole motion. So for this one, you could either inhale, exhale, or if it's heavy, you would exhale the whole time. Now I'm trying to get some of that glute med strength, that outer hip strength. So I'm gonna have a band above my knees and doing little walks. And what I see a lot of people do whenever they do this, they do this like weird like lean over thing, right? But you want to actually keep your body really, really stable as you do it, keeping your whole body upright, toes pointing forward as best as you can tolerate it. And you shouldn't feel any pressure or like pelvic pressure whenever you do this, but if that's the case, you can try to exhale to see if it releases that pressure. I mentioned that adductor strength, and so we're gonna go ahead and grab a small ball. This is about like 4 to 6 inches. You're gonna put it between your knees. You'll pull one hip back and then squeeze that ball with your inner knee, and you'll go in and out of that 10 times. And from the side, all I'm doing is my butt is kind of rounded here. I'm gonna pull that hip back, so it's like I'm pulling my whole pelvis back. I'm gonna squeeze as I exhale. I'll do that 10, 15 times. You should feel only your inner thigh really getting tired, and then after that, you'll do it to the other side. And then working on that single leg balance, you can find something that's kind of fluffy. You can put your foot down on that, and then just try to get your balance. Try to see if you can hold your balance for up to a minute per side, maybe like 10 seconds at a time, and then switch sides. What a lot of people do is they'll just kind of like dip, you know, on one side. So you want to try to keep your pelvis stable as you just play around here, and do that for like up to a minute. Last example of exercise is the elevated planking. So instead of going down to the ground, you're going to be elevated at a surface, keeping your body in one line. You could do fun things like moving around side to side. You could do little shoulder taps if you wanted to. You could do little pelvic tilts if you want to. But making sure that you're exhaling while you're doing it, so that way you feel the deepest layer of your core activating while you're in that position. I'm out of breath just from filming those. But those are all examples of things that you can do. You could just do those all as like one workout, doing like reps of 8 to 15, depending how hard or easy they are, doing 2 sets. You kind of want to feel a little bit of a muscle burn if you can. You don't have to though, but those are all examples. So let me know what you think in the comments. Don't forget to check out my links on my TikTok, my Instagram, because I've been posting there for 5 years. So I have a lot more content on this stuff. And yeah, thank you so much for being here, and I'll see you in the next video. Bye.